All right, we should be all set here. Give it a minute. Okay, we are good to go. Excellent.
All right.
All right. Okay. Well, thank you everybody for joining this morning. My name is Jamie Chavez. I'm the president and CEO of the Westminster Chamber of Commerce. And every Wednesday, we bring to you a live broadcast featuring one of our newest members so that they have a chance to introduce themselves and talk about their business. So if this is your first time joining us for this broadcast, a special welcome to you. Thanks for being here today. You can follow us on Facebook to make sure that you get notifications for when we go live in the future. And if you are on YouTube, you can hit subscribe and explore previous broadcasts there as well. They go back forever. We also offer broadcasts on Monday, which are feature city updates. And so we interview our counselors, city staff, mayor, and other key city people just to give you an opportunity to see what's going on down at City Hall. So we hope that you will tune in for those ones as well. As you watch this broadcast this morning, please feel free to engage with us, drop any comments, ask any questions, or just say hi, and we will get to all those comments during the interview. And now a warm welcome to Tim with Choice Home Health. How are you today?
I'm doing well.
Choice Health at Home. I'm so sorry, got that wrong. Choice Health at Home.
Correct. It's all good.
Yeah. How's your morning so far?
It's been good. There are steady mornings, busy mornings, caring for people, but it's been a good Wednesday start.
Great. Awesome. Well, for people who may not know, tell us a little bit more about Choice Health at Home.
Yeah. So we're new to Colorado, but we've been in business for almost 18 years. And we have three primary focuses. One is our skilled home health side, which is caring for individuals in their homes following incident, accident, injuries, and helping them transition from being need a lot of care at home to getting to outpatient, to getting back to their independent level that they were having before the injury or accident or illness. And then our second part is we have a hospice team as well as a personal care side that goes into the home and help with personal care items on a more extended basis. Our home health side is really based on short-term rehab at home for physical therapy, occupational therapy, speech therapy, nursing, social workers, everything somebody may need to help with that recovery and get back to the highest level of independence.
Got it. Okay. So what inspired you to get involved in the home health industry?
It goes back many decades. It goes back to being in the military, being in the medical field of the military, getting out as a nurse, working in nursing homes, and then moving to home health about 15 years ago. And it was really the focus of helping people stay at home, stay independent. With all the changes going on with our population as we continue to age, the silver tsunami, they call it, people are aging and they're living longer. And our goal is help them live a more quality life versus a quantity life. And so we've been fortunate, and my passion around that is helping every individual succeed to whatever level they want to succeed to. So it's rewarding in that individuals are staying in their homes, but also fantastic to see them recover from an injury that 15 years ago may have been led to a nursing home or a senior living community. And now they're getting more time at home.
That's amazing. And so is that the mission of Choice Health at Home? What is the mission there?
Yeah, our mission is to be patient-centered care, to ensure that we are helping every individual achieve their personal healthcare goals, whether those goals are both short-term or long-term. So we'd like to be there for them and be that resource for them. And to that point as well, we also work with almost every insurance company out there, from Medicare to Medicaid, to United Healthcare products, to Aetna, to VA, TRICARE. So our services are 99% of the time covered by the insurances.
Okay.
And so our goal is to help navigate that process to ensure people are aware of their benefits, help them obtain their benefits, access their benefits, and then care for them at home.
Okay. So what are some common situations where someone might benefit from home health care, or like who's a good candidate for home health care services?
Yeah, the majority of our clients are the 65 plus, 75 plus population. They're our grandparents. They're some of our parents. And for the most part, they may have been living a normal life. Everything's going well. And they get ill. They end up in the hospital. They're not ready to go home, but they don't need a nursing home. And so they're looking for that support at home. So we work with the hospital teams at discharge planning to ensure that the patient's home health needs can be met. So that's part of our candidates. The other ones are individuals who had a surgery and they're not ready to go to outpatient. They can't get there. It's too tough to get there. We take what they start at the hospital, go to their home, continue that, and then transition to outpatient. And the other group is individuals living in assisted living communities where they're aging, and through the aging process, they've gotten weaker. We come in at that point as well to help to give them back to a higher level of independence. A lot of times we're saying, okay, what's your baseline? And we come in, assess that, do some work with them, work with the team at the assisted living to boost them up to a higher level so they can maintain their independence. And then the other one is they gone from a hospital to a nursing home or to a inpatient rehab facility. They've gotten stronger there, and now they're ready to go home. And we go into the home with them and make sure the home is ready for them as well, in the sense that when individuals are at hospitals or nursing homes or communities like that, they're getting 24/7 support. Everything is designed in a way that keeps them safe. You have handrails, you have wide hallways, you don't have trip hazards. So part of our job is also going into the house, not only care for the individual, but it's also look for safety factors in the house that may be causing them to have additional accidents in the home or not succeed in the home. So our team, patient therapists, speech therapists, physical therapists, nurses all go in the home with one eye on the client and one eye on the physical environment to make that better for them as well.
Okay, that's awesome. And you mentioned a few of these, but what other types of services can patients actually receive in their home?
So it can be everything. Sorry, it can be everything from IV therapy to nutritional therapy to post-orthopedic surgery or recovery. We're really known for our significant wound therapy treatments in the home. Individuals have had serious injuries where they've had terrible wounds or they developed wounds. We go for that side as well. And then our social workers can also help with navigating the different benefits that are available to the clients in the community. There's so many different benefits and opportunities to support them in the home that people are not aware of. So our social workers are trained on that side of it. Okay. And then we can go in the home and treat post-stroke, post-cardiac. We work with Parkinson's. We work with Alzheimer's in the homes. We have many programs specifically designed to help support individuals, again, across a variety of different diagnosis and treatment needs.
Okay. And then you also mentioned that you have hospice services.
We do. Yep. Okay. So, the end of life happens for all of us. And hospice is one of those terms that people look at initially and say, why don't I go on hospice? It means that the end is imminent and I have no chance. And we look at it very differently. We actually partner with palliative care program partners who help with saying, okay, here's what's going on in your life. And it's a struggle on your day-to-day. You're in and out of the hospital a lot. Let's help manage this chronic problem. And then as that advances, then we look at the hospice side. Then our hospice team comes in and is really there for the individual and their family. It's a very hands-on, across our business lines, we're very high touch. It's very hands-on, very supportive. Again, it's never an easy decision to go with hospice, but the team members we have on our hospice side are truly just amazing people. From the CNAs to the nurses to the teams, that they're so dedicated to being in support of that individual and their family to help that transition be successful. Yeah. With life, majority of them, we have one chance to experience end of life. And our goal is then when that time comes for somebody to be there for them, make that transition the best transition possible for everybody.
Okay, that's great. What signs should families look for that indicate maybe a loved one may need additional support at home?
So if you're looking at, it would be if you're finding that your family member, your loved one is not thriving. It's an easy term to say, the failure to thrive. You're seeing that, what they normally were doing as far as taking care of themselves with medications, with their day-to-day activities of daily living, their diet. Are they eating? Are they taking care of the house? That's one of the first times we see that there's some challenges going on. And that's more looking at a slower decline. So that'd be where they can reach out to me anytime. I can walk them through the different options. Sometimes we're the right option, sometimes not the right option. But our personal care side is great about being there for that part of it. Going to the house, help them with the morning, get things going for the day so that they're set up for success for that day. And then on the home health side, it's, again, you can see some weaknesses happening. Maybe they're struggling to go out and get the mail. Maybe it's a challenge to do their laundry, to cook for themselves. to go anywhere outside of in their house.
Mhm.
We talk to the family and find out where they were at, talk to their physician. Everything we do is involved with the family physician as well, the patient's primary care physician, to look at, what is it that we're seeing from the clinical side that we could be supportive of to help recover on that side too.
Mhm.
So to your question, it's not one answer. It's really a broad spectrum of here's what's the family seeing. And again, the family knows that client best. They've seen these changes. And our purpose, our conversation always involves like, we know why we're seeing them today, but tell me what's happened in the last 6 months, the last 90 days. What significant changes have you seen in that period of time that we need to be aware of so we can set the right goals and the right expectations both for the client and the family?
Okay. I feel, everybody's part of different communities in their lives, and one of the communities that I'm in is a caretaking community, and so a lot of parents that are caretaking for children that maybe have things going on at home, and so I am exposed to people who are feeling overwhelmed a lot in that. And so, how can you guys help those caretakers at home feel less overwhelmed?
Yeah, the caretaker burnout's a real thing, and we see it initially with a spouse if they're still with them, or the adult children where they're trying to balance being a parent to their own children and taking care of their own our parents, and scheduling appointments, being with these appointments, getting the right information. So what we do in that situation is that's really where our personal care side comes into play,
Okay.
where they can talk to that team there and say, boy, here's what's going on. And we involve our social workers at that same point to say, okay, for a caregiver burnout and just even kind of a respite moment for you to have from being there, responsible for yourself, your children, your parents, is what can we do to be supportive of that? And sometimes it's, just us coming in for a day, a week, 1 day per week to give them that relief. It's allowing us to be there for them so they take a vacation. And it's hard to specify one situation, but it's asking the family, what is that you're looking for? And sometimes they don't know. Like, there's a side, I don't need help. They're my parents, or it's my spouse. I'm going to be there. But they don't realize also it's a taxing effort on them because now they're getting exhausted. They're not fully engaged with their own family and their own careers. And that's really where the different resources between what we can find from the community resources to what we can provide as a company to be there when they need us to be there with them.
Yeah, definitely. And how do your care teams, your nurses and your therapists, how do they all work together to support patients?
Yeah, so I'll start with the home health side. It all starts with the referral and the team that refers to us, like, hey, we want nursing, we want physical therapy, we want occupational therapy, we want the whole cafeteria plan. We ought to go out there. And so there's rules that say, okay, here's who sees the patient first. But every one of our clinicians and here in the office as well, we all share the same health record data, electronic health record database. And so when we admit a client, everybody who's assigned to work with that client sees the big picture, what's going on. And they also see each other's notes, and there's care coordination going on there. So the nurse goes out and they assess the patient and they look at what they're doing as a nursing team member. And then physical therapy goes out, sees what nursing has done, then enter their plan of care. Occupational therapy, social worker, all working together, and then it creates one big picture of what we're all seeing, how that client's doing. And then on the home health side, like I said, it's really short term on our part of it. So then it's really looking at the goals, kind of 30 days at a time. The first 30 days, we're going to achieve this. We're going to do this many visits. We're going to see the patient this many days a week. And then we have case conferences every week where the team comes together and reviews all the current patients from the most recent admissions and who's on service, who just came on service, who's discharging. And they look at what's going on. And sometimes it could be where nursing is already done with their part, but physical therapy is staying in, or occupational therapy is staying in. So they may all start together. They may not always end at the same time, but there's also times where maybe it's just one or two in the beginning and they identify another need and that gets added on later. So the coordination is ongoing throughout that episode. If you imagine, it's like being in the hospital, but at home. In the hospital, you have your doctors involved, you have your nurses involved, everybody's involved, but they're all right there. We see each other every day. Here at home, now the client's home, and now we're still talking to the doctor. We're still involving the family. We're still involving our team members. Only we're all doing it through the benefits of digital platforms through Teams meetings and Zoom meetings and those kind of things, but also, again, always updating the doctor as well.
Okay.
And as the plan proceeds, then it's communication with the patient and or their family if they're involved as well. Say, here's how we're doing, here's how things are progressing, and we think we're getting close to discharging and maybe going to outpatient therapy or discharging services and you're good to go. And the family has a chance to review that part as well. And then we also do a check-in. About 60 days after discharge, we'll also check in with clients, say, how are you doing? And we encourage them to call us too, because if they're feeling really good right now, they're getting the therapy, things are great, and they start noticing, the family starts noticing, hey, over the last 2 weeks, mom, dad, spouse is not doing as well as they were doing. So we need to, what do we do now? They just call us again. Then we initiate the process. They say, what's going on? Let's look at this. Then we take that responsibility to talk to the doctor and either re-engage and do another episode of care, or we give them advice to where to go next. And so sometimes it's just, go see your primary care physician, and let's get that started from that point.
Okay, great. Are there any misconceptions about home health care that you've heard, or truths that you would like to?
Yeah, I'd say on the home health side, I say it's one of the things is that we see commercials all the time for home health. These companies do home health services, and it's important for individuals, both the clients we serve and their families and the community at large, to understand there's skilled home health, and then we call it non-skilled or personal care side. We're still lumped under the same category of home health, but the skilled home health side means that we are certified by Medicare. We've gone through a process to be recognized by the government that we are a certified home health company, and all of our clinicians are fully licensed, fully background checked, and then we also work with insurance companies, and the insurance companies work with us as well to ensure that their clients are staying at the healthiest level, because healthcare is expensive, and we are the least expensive option for healthcare. So insurance companies like to partner with home health companies, saying, okay, the cost of doing business with home health is a small percentage number of hospitalization or an ER visit. And so I would say a couple of misnomers that it's expensive. It's not expensive. And if you're over 65 and you're on Medicare or a Medicare Advantage program, almost 100% of the time your full cost is covered. If you're younger, we do serve clients who are younger, from 18 up to, I think our oldest one is 104. That if you have a commercial plan, you may have a copay on your commercial plan, like you have doctor visits. And so those are things that our team also looks at. And when we get ready to do a plan at start of care, before we do that, we also share, here's your insurance benefits, here's what is covered, here's what's not covered. So I think there's the misnomer would be that's expensive, it's not accessible, it's very accessible. There's responsibilities on both sides. The clients have to want to get to work with us, and there's some restrictions as well. So one of the restrictions with home health is that the term is homebound, meaning that we cannot come to your house, do our treatment there, and then you take off and go hike Longs Peak, and saying, well, I get my therapy this morning, I would do this. So there's some restrictions there as well. But for the most part, when people are using our services, they recognize that they've been ill, they've been injured, that the recovery is in progress, and it's routinely not a problem at all. But yeah, so the cost part would be the one thing there. And then on the personal care side, for accessing that, look at your long-term care insurance policies. Some have good coverage for that. If you have those policies for your parents, or your parents have those, that's one way to look at it too. And again, the good personal care businesses will help you navigate that part too.
Okay. Great.
And on hospice is a benefit that the government supports 100%. Doesn't matter if your parents are on Medicare Advantage programs like United Healthcare. Once you go on hospice, they switch to traditional Medicare.
Okay. And we have an aging population, as you know. How do you see the role of home health evolving in our community with the aging population?
What we've seen a couple of big moments. One was, 20 years ago when we started seeing the first indication that Medicare is actually looking at their bottom line and saying, boy, we're spending a lot of money in hospitals and nursing homes. Mm-hmm. What can we do at home? And then when COVID happened, the restrictions of getting individuals admitted to nursing homes, post-hospitalization, it took time, there was delays. The insurance companies looked at home health even more then and said, okay, what can you do at home that may not be quite as good as 24/7 care at a nursing home for rehab or a hospital, but maybe it's most of the way there. And they identified that home health is that area that people want to be. People want to be recovering at home. They want to get better at home. And so we saw a big increase on that side too, post-COVID. And we're seeing it continue to grow. We're seeing insurance companies come to us with more complex patients, more complex diagnosis. And we as an industry are stepping up and doing more training, getting better equipment, getting more resources from our healthcare industry, from the different type of access to, whether it's electronic access for EHR systems or IVs or wound care, supplies being delivered to the house. We're seeing a big improvement in everybody working together in this part of the healthcare continuum, this post-acute sector. And so I think we're going to continue to see that really grow. And we're also seeing with the aging population that we're seeing lots of senior living communities opening up. But if you have a parent living there, if you're living there, or if you're the grandparent living there, it's not free. And so that's the part too we're seeing, is that the individuals love their homes. So I think we're going to see home health still continue to grow. I think we're also going to see an improvement in home modifications to make the home more livable and age in place at the home for a longer period of time. And so I think that, to your question, we're going to see home health continue to become a more important part and a more proactive part in the planning of ensuring that individuals are able to maintain their independence as long as possible.
Yeah. And when you're making the decisions for who to bring onto your team to help support your patients, what qualities make someone successful in the home healthcare profession?
It's interesting because we hire lots of clinics. We have over 70 employees, and we have again physical therapists. We have all the different clinicians that are working with us, and the one common trait that improves success for the employee, for the agency, for the client, is that they've had a connection with a grandparent or they have an aging parent.
Yeah.
Because if you've never had that connection, it's hard to go into a house or a residence and recognize that you're being invited into their house, and this individual has decades of history and experiences. And part of our role is not just being a nurse or a physical therapist; it's also being a listener. Because whether we like to say it, believe it or not, isolation does occur. And so we tell our team members, you're there to do your clinical specialty, but you're also there to have a conversation and engage with this individual, develop a rapport, develop a relationship, because they have to trust that we're coming here for the right reasons, and they have to be confident they can share with us. So the biggest one is that they've had that relationship with a grandparent or an aging parent, that they just have that love for the geriatric population. And that's the biggest key factor right there. And then goes all the other things that we all look for in employees. It's, are you responsible? Do you show up? The things that we all think every employee will do when you interview them, and the majority do. But yes, that's the key thing we look for, is that relationship building.
Yeah, that's amazing. Do you see any challenges or opportunities right now in health at home?
It's the opportunities we look at is a couple of things. We are seeing what we can do to be more proactive with the insurance partners, to be saying let's get in there sooner. Let's have some increased access before they've declined so far or gotten so sick that they end up with an expensive hospitalization. Allow us to go in more routinely with just early onset, early identification of some declines, so that we're not going from a point of being at 50% of what they were 3 weeks ago. We're coming at 90%. So we can go in there, be more efficient with it, and be faster with that side of it as well. Okay. And I think we're also going to see increased collaboration with outpatient therapy. And, maybe there's ways to actually work with the physicians that are following the patients to do a little more complex things at home sooner, pre-hospitalization side too. So I think I don't think it's continually evolving. It's changed a lot in the last 15 years. It's going to change a lot in the next 5 years, especially with technology improving all the time and access and those kind of things.
Okay. Can you share an example of a condition or a recovery situation where Choice Health at Home really made a significant difference?
Let's see. Yeah, I like to think we have many examples, but one that does stand out is we had an individual who had been declining. They ended up in the hospital. They went to it's a inpatient rehab facility following the hospitalization. The recovery is going slow. And it was really to a point where they're like, we don't think they're going to get home. We think maybe a nursing home, long-term care could be the option. They spoke to us. We went down, met with the client at the bedside at the facility, discussed what kind of things we could do, learn from them, what was impacting their recovery at the inpatient rehab facility that may be delaying or preventing them from being successful. And it ended up being that they felt that this was just the process of aging. Mm-hmm. So we worked with them and talked to our team in advance, and they discharged home. And we actually made more gains in the home with their rehab and recovery than that they had gained at the hospital and at the inpatient rehab facility in that combined time, because everything we do is about positive recovery. You can do this. We're going to work on this, and also, we learned from them, again, the relationship side of it. We are coming to their house, we're sitting down talking to them, what kind of things what things that you love about being in your house. And then got the neighbors involved and the family involved. And that person's still at home now, and they're still doing well. And it's interesting because that individual and others will still call and check in with their nurses and their therapists, just out of just saying, hey, I'm still doing well. I could have done without you. We get letters from our clients saying, I had no expectations of anything when you guys came in, but now I am living better than I was previously. And so it's also going to be shared with our team members as well. But that's one example, but we've had many examples where individuals have just continued to recover faster, better, because again, they're in the home environment.
Yeah, that's incredible. Thank you for sharing that.
Yeah.
Do you also work with, we've talked a lot about aging population. Do you also work with kids or like postpartum?
We do not. We recognize that we could do pediatric care and mom-child care, but we also recognize that our clinicians in our team is more suited for the adult population. Okay. And we trust our counterparts who are experts in pediatric care to be that group.
Awesome.
So yeah, it's not an area that we've explored, and right now there's no plans to do that. I know some really good groups out there that do a lot of great things with the kids and the mom and baby.
Great. Well, what's the most rewarding part of your work? Like, what motivates you and your team every day?
I guess that we are all here, and we get to every day come to work knowing that we're going to have a chance to positively impact somebody's life. And it could be somebody we're already serving. It could be somebody who's being referred to us. It's being that resource. As I said earlier, anybody can call me and ask me questions, whether they're a client of ours or not. It doesn't matter. After decades of being in the healthcare industry in the Denver area, you meet a lot of people across the continuum. And so it's one of the things is that we like to say that the healthcare industry is large, but it's small. And so we have trusted partners. So if we can help somebody, if we can learn what the problem is and be the solution to that problem, whether it's us doing it ourselves or we find them another company that can do that for them, that's probably the most rewarding part of the entire day.
Yeah, I bet. And we just have a couple minutes here. Is there one thing that you would like people watching this to remember about Choice Health at Home? What would it be?
That we are a company that was founded by a gentleman who is a physical therapist, and his grandfather needed a therapist, and there's no therapist in that town or with that hospital. So the whole base of this company in 2007 was that the CEO of our company, his grandfather needed care at home. And that's been his driving focus through growth, through opportunities to care for individuals. It always comes back down to what is needed by the client, what is needed by the community, and how can we be that resource for them. And our team here is all based in, we like to say, we work where we live. Yeah. So our clinicians all work within the community they live. And all of us here have families. We have kids in school, kids in college, and that we are a growing company, but it still feels very intimate and community centric, because no matter where we have our clinicians, we strive to work within that community as well. So yes, we're in Westminster as an office, but we also support wherever our clients and our clinicians live and work, through the schools, through the community itself, and different services.
Okay, great. Thank you so much. For anybody that's watching that might be interested in learning more, what's the best way to reach out?
You can call me. My number I'll tell you my number, 720-840-7755. Again, my name is Tim Hieronymus, and you can reach me at any time. Or just call the main office number at 303-424-8000. Ask for Tim, and I'll be happy to take your call, have a conversation with you, and hopefully guide you to the right solution for yourself, for your family member, your parents, and what you may need.
Okay, fantastic. Well, Tim, it's been really good to chat with you today. Thank you so much for coming on. It was a pleasure to learn more about Choice Health at Home and what you all offer the community. So thank you so much.
My pleasure. Thank you for having me.
All right. Goodbye, everybody. Have a good rest of your week.